Hello, this video is for radiologic technology students to learn the radiographic criteria of a PA Caldwell Skull X-ray and how to assess the PA Caldwell Skull X-ray for diagnostic quality. So the first thing we want to do is make sure that we didn't clip any anatomy at the top and the bottom or side to side. So we're going to look for the vertex up at the top, and then follow the border of the skull around to the parietal eminence to make sure that we did not clip the lateral borders of the skull, and continue to follow that down to the mastoid tips, the right and left mastoid tips, and we can follow the mastoid tip around that base of the skull here, and then to the other mastoid tip, and then up around this lateral part, parietal eminence, all the way back up to vertex. So this tells me that we have not clipped any of the skull. Now the Caldwell skull is for the frontal bone, and that is right here in the center of the image here, the frontal bone. So in order to see the frontal bone, we ask the patient to flex their neck and to place their forehead on the bucky or the IR. And then we will take the tube and we will angle 15 degrees caudal, entering posteriorly and exiting the nasion where the bridge of the nose is, anteriorly on the face. In this image, I can tell that maybe the patient was unable to flex their neck enough to place the positioning line, the OML, perpendicular to the IR, and that's why the petrous ridges are not where they're supposed to be. So let's identify where the petrous ridges are here. All right. Now on this image, the petrous ridges are a little lower than they should be. The petrous ridges should be right around here in the lower 1/3 of the orbit. So the petrous ridges should be superimposing the lower 1/3 of the orbit. In this image, the petrous ridges are a little lower than they should be. That tells me that the patient did not sufficiently flex their neck to place the OML perpendicular to the IR, or another error that could have been made that would cause this radiographic outcome would have been excessive angulation of the tube. Excessive, more than 15-degree caudal angle would cause the petrous ridges to be projected lower than the orbit. So, just wanted to identify that for you, that this is not, an optimal diagnostic quality PA Caldwell Skull X-ray as far as we learn, the criteria. So the petrous ridges should be in lower 1/3 of the orbit. All right, now moving on from that, we can go ahead and identify some other structures. We've already looked at the parietal eminence, we looked at the vertex, we looked at the mastoids. Now let's go in the center here. We can see the crista galli of the ethmoid, crista galli there. We can see where the cribriform plate of the ethmoid is, just inferior to the crista galli. All of this area in here is ethmoid. This is the perpendicular plate of the ethmoid meeting up with the vomer to create the bony nasal septum. We can identify the lesser wings of the sphenoid. They kind of are like this, swoop horizontally across the orbits of the skull. So that would be the lesser wings of the sphenoid. And then if we follow this line here, right here, this is the greater wing of the sphenoid there, coming up more vertically. So those lesser wings are more horizontal. The greater wings sit more vertically, and both of them kind of superimpose the orbits in this image. All right, and we can follow those lesser wings around to that coronal suture. Also, we can see the frontal sinuses, because this is going to identify and demonstrate the frontal bone for us. So we can see the frontal sinuses. We can see, of course, the petrous portion that we identified, the mastoid portion here that we identified, and the mastoid process and mastoid tip, the very bottom of the mastoids, and also the base of the skull here. So that's really what we look for in this, the Caldwell skull image. All of those structures are what's of most importance to be able to identify and demonstrate. Um, and these structures here are the zygoma right here at the lateral borders of the orbits. That's the zygoma there laterally. That's a facial bone, so it's not part of the skull exam, but it is there. But in order to identify that the patient was placed without rotation, we're going to be looking for symmetry of right and left structures. So I would say that the orbits are the easiest to see on the Caldwell skull here. We can see the orbits very clearly. And what we can do is measure from the lateral borders of the orbits to the lateral border of the skull. And we want it to be equidistant on both the right and left orbits. In this one, you can see that there's more distance if we measured it from the lateral border of the left orbit to the left lateral border of the skull than there is here on the right. It's closer. So this tells me that the patient was turning towards their right. Their eyes are looking towards the right side of their head. So we have a tiny bit of right rotation in this image and maybe some insufficient flexion or excessive caudal angulation errors in this image. I hope this was helpful. Thank you for watching.